Good morning. Still dark out there and rainy, so thank you all for coming. It is my pleasure to introduce our first, what's going to be a semi-annual event, speaker related to mentorship and Winship. And we could not have been more fortunate to choose and get to agree to come and speak for this inaugural mentorship talk than Dr. Sarah Donaldson. So Dr. Donaldson, I'm pleased to say, started her career as a nurse, where all good things begin, and went on to medical school at Harvard, where she graduated and then went on for residency at Stanford University, where she has been ever since. Dr. Donaldson is an internationally recognized leader in pediatric oncology with specific expertise in Hodgkin's lymphoma and rhabdomyosarcoma, and the late consequences of survivorship in childhood cancers. She has a list of accolades longer than her talk, so we can't go through them all. But just to mention a few, she has been a trailblazer. She's broken the glass ceiling in a number of areas, including being the first female president of the American Board of Radiology, the first female president of ASTRO, and the first female president of the Radiology Society of North America. She is, of course, in the National Academy of Medicine, formerly IOM. She's a fellow of ASCO, ASTRO, and the list goes on. But what I really want to mention, and why we've specifically brought her here today, in addition to hearing about all the wonderful things in her career, is that she is the very first inaugural recipient of the Women Who Conquer Cancer's inaugural Mentorship Award. And so we've very specifically asked Dr. Donaldson to tell her story and how mentorship helped rocket her to such a stellar career. So that's what we're going to talk about today. Welcome.
So, Deb, thank you for such a warm welcome and very kind invitation. I am truly flattered to be here, and I'm so pleased to have this opportunity to spend prime time with you now and with many of you later this morning. Your invitation, Deb, to speak about mentoring is very special to me because it's an aspect of medicine that has been underappreciated and underserved. And as will become quite obvious to you, I feel very strongly about mentoring. It's a vital component of education today. Now, historically, there hasn't been much attention paid to mentoring, at least not in medicine. But in other graduate programs, such as business schools and schools of education, mentoring is emphasized and is oftentimes part of core curriculum from the very beginning of classes. But in medicine, we've been slow to appreciate the value of formal mentoring programs, which I find strange, because medical training is very much one of an apprenticeship, which invites a very strong student-teacher relationship. But today we're beginning to see more attention placed on mentoring programs, or oftentimes embedded in leadership initiatives, such as seminars and courses on how to become an effective leader. And did you know that just last month, in January, was National Mentoring Month? Now, this didn't receive much attention, but it does reinforce that in medicine, we're beginning to place more emphasis on mentoring, and it's really becoming quite trendy. So I want to congratulate you at Winship for your formal mentoring program, which I find impressive. The very fact that you have a mentoring program distinguishes you from just about everybody else. And I believe your program, Deb, may well serve as a template and a model for many others to follow. So congratulations, Deb and Wally and your entire Winship team for all that you're doing. One of the most valuable consequences of accepting an invitation to visit a center is that oftentimes you gain more than you give. And I'm looking forward to learning a lot on this visit. I'm really pleased to be here, to meet with you, to give this grand rounds, and to give you my spin on mentoring as applies to cancer, to oncology, and to a cancer institute. So for those of you who are curious about a talk on mentoring, or why bother get up at 7:30 in the morning for a talk on mentoring, I've chosen the title for this talk, The Joy in Medicine, because I see mentoring as a way of putting the joy back into medicine. And I'm going to address mentoring by answering the perhaps obvious questions of what, why, how, and who. What is mentoring? Why bother to do it? How do you do it? And who should do it? And in getting prepared for this talk, some of my information has come from my own reading, some from my Stanford colleagues, but mainly I'm going to talk from my heart about my own life experiences. So for those of you who like biographies, I've decided to open the dusty pages of my own diary and to tell you some personal stories, share with you stories about a young girl who was largely focused on playing the ukulele and cheerleading at one point in her life, who later emerged to be a professor of radiation oncology. And the connection from point A to point B constitute the theme of this talk and help explain why I've titled it The Joy in Medicine. And I'm going to tell you this story, but to put it into proper context, first we need to have some background information on the what, why, how, and who. So to begin with, we really need to recognize the perhaps most talked about person in all the circles of higher education, including medicine, and that would be Mentor, the elderly friend of Odysseus. And Odysseus, king of Ithaca, was the legendary hero of Greek mythology whom we all read about when we read Homer's epic poem, The Odyssey. And a mentor became known as one who imparts wisdom and shares knowledge. Now, mentors have a big job. They must guide, advocate, support, and serve as role models, and the best mentors do all four. A mentor is really a coach, and whether you think of your coach as a leadership coach or an executive coach or a life coach really doesn't matter. It's the relationship that matters. And my own interpretation of mentoring is that it's a relationship focused on one's trainees, and that involves a two-way commitment. Certainly a commitment on the part of the mentor, but also a commitment on the part of the mentee. And this relationship must be organic. By that I mean it must be pure, must be natural, and it cannot be forced. In medicine, mentoring is absolutely central to the effective development of students and trainees. And there's a huge amount of literature on this subject, most of which clinicians and physician scientists find quite boring. And I'm not going to discuss this literature today, other than to tell you, if anybody's interested in it, I'm happy to share it with you. But I want to emphasize that the literature speaks for and demonstrates that mentoring works, it's effective, and it's needed. I can tell you on firsthand experience that there is nothing so gratifying as to witness the success of your own trainees, those you've mentored. So the question comes up, how do you do it? How does one mentor? And the responsibilities of mentoring start with communication. And by that, I mean listening, providing feedback, optimally prompt feedback. Sometimes it involves managing conflict, and it involves fostering trust. And the second responsibility has to do with the content of the mentoring. And this involves many components. Certainly involves clinical skills, it involves research, it involves education, and quite often the mentee feels like he's being pulled in many directions. Now, the content may identify gaps in knowledge, may find opportunities and resources, may help formulate goals, establish a timeline, monitor progress. Importantly, the mentor must step aside and allow the mentee independence. Now, the third responsibility has to do with support. And I mean support in work-life balance, support in time management, support in how to prioritize, and how to develop leadership skills. Support is practical wisdom at its maximum. And the fourth is serving as a role model. Role models can facilitate opportunities, they can advocate, and they can help you navigate the system. And much of this is what I call out-of-classroom knowledge. And out-of-classroom knowledge is really important. And you might ask, well, does mentoring work? One of the topics generating enormous attention today, particularly in medicine, is one of gender equality. And during the 1970s, AAMC data showed us that fewer than 10% of medical students were women. Well, this percentage dramatically increased over the late 1970s and the 1980s. And then by 1990, 40% of medical students were women. This number approaches 50% today. But the percentage rise is leveling off. The trajectory is nowhere near as steep as it was in prior years. And there are inequalities when we look at the pipeline to leadership for women. Starting from entering medical students up to most senior leadership positions, there is a decline in the percentage of women. Whereas nearly half of medical students are women, only 38% of full-time faculty are women, just 21% of full professors are women, and only 16% of department chairs and deans are women, despite a vocal group of feminists calling attention to these data. This is a leaky pipeline. And within oncology, the numbers are similar. ASCO data show us that while 36% of ASCO members and meeting attendees are women, just 27% of committee chairs and board members are women, and only 13% of ASCO presidents have been women. But now we know that mentoring makes a difference. Mentoring helps generate gender equality. And let me say that mentoring is not gender specific. Mentoring is about connecting trainees, men and women, with leaders and sponsors in their field. And mentors say that mentoring is critical to success, but finding a supportive mentor can be a challenge. So mentees, you need to be proactive, you need to make your needs known, and you need to ask for help, because success requires that you seek and you find those people who can help you make your own way. And why should one want to be a mentor? Well, just think. Mentoring can help change the lives of your mentee, and mentees benefit in many ways. So mentees, you'll develop professional skills that will lead to career advancement. You'll enhance your self-confidence. You'll increase your academic and your scholarly productivity. You'll enjoy networking and meeting new people. You'll develop professional satisfaction, and you'll have the benefit of dynamic role models. And one cannot have too many role models, because diverse role models lead to diverse pathways to success. And these benefits for mentees are especially important in environments where criteria for advancement are ambiguous and knowledge of the unwritten rules is paramount. This is another example of out-of-classroom knowledge. And there are many benefits for the mentors as well. So mentors, you'll learn leadership and counseling skills. You'll become more committed to your organization and you'll be recognized. You'll experience new satisfaction in your career, and you'll gain enormous satisfaction of helping others develop. You'll help plug the leaky pipeline, and you'll transfer knowledge. And by this, I mean you'll find access to new perspectives and new expertise. And I call this reverse mentoring, because you learn a lot from your students. For example, without students, I would have far fewer computer skills. And I certainly would have fewer youthful friends, because teachers learn a lot from their students. And this leads me to tell you some tips that I learned when I served as residency program director. I learned that in order to serve as an advocate for my residents and keep them happy, I needed to know what it is that they wanted and what they really needed. But residents will not open up to you unless they trust you. And developing this trust takes some time. And the best way to cultivate this trust is to spend time with your trainees. You need to learn how they think, and eventually you learn what it is that they want and what they need. And a side benefit of this is that when you hang out with your students or your residents, gradually you adopt some of their habits. In my case, the residents invited me to go to the gym with them. But it was the spinning class that made the difference. Because after the weekly spinning class, we'd go out to dinner. And that was the occasion when they would then talk to me on their level. And then I became aware of what their needs were, and then I could become a better advocate for them. And along the way, I got into better shape. So through my residence, I actually found a new pathway to improved health. And now I've graduated from the gym to the road, and we can go biking together. Now there's a famous clinician educator, Francis Peabody, who is greatly admired for his patient care. And he said, the secret in the care of the patient is in caring for the patient. And likewise, the secret in being a good mentor lies in caring for your mentee. It's just that simple. You just have to care. And if you mentor well, you're likely to continue the legacy of mentoring. And it's a most important addition to one's treasure chest of education. And in thinking about this talk, I know of no better way to emphasize the importance of mentoring than to share my personal experience, because it had a huge impact on me. Now, quite often I am asked, how did I happen to go to medical school? How did I happen to select radiation oncology as a career pathway? Well, Deb asked me to tell you, and here's my story. I started out my professional life as a nurse, as she told you. And nursing was my passion, and it was my career aspiration from the time I served as a student volunteer in the local county hospital till I had my first job working as a nurse's aide. And I declared nursing as my intended major when I went off to university. And then, as a new graduate with a Bachelor of Science and a registered nurse degree, I was offered a job by a young surgeon named Dr. Bill Fletcher to help him develop an ambitious cancer program. And my job description was quite vague, but it emerged that I became his right arm assistant in the operating room, in the tumor clinic, in the tumor board, and in keeping the chemotherapy files for those very early clinical trials when 5-FU and vincristine were experimental agents. Because remember, in those early days, there was no field of medical oncology, and the surgeons were the primary cancer doctors. Now, my job also had a laboratory research component to it. Dr. Fletcher gave me a small animal project where I transplanted melanomas into the hind limb of hamsters. amputated their legs, and then studied systemic therapy, such as Coley's toxins, which today we would call immunotherapy. So, as the story emerges, Dr. Fletcher became an influential mentor to me. And one of the lessons from this mentoring experience is the importance of being a novel thinker, one who thinks beyond the perspective of most others, and also somewhat of a risk taker. Now, Dr. Fletcher was certainly a visionary novel thinker. He defined my job as his nurse, which later became a laboratory assistant, which later became a clinical research associate, and then a surgical oncology nurse, perhaps the first in the country to have this job. And we were both risk takers, but mainly the risk was on Dr. Fletcher's part, because I was too naive to know much better. But I was curious, and I was driven to succeed. In short, I didn't want to disappoint my boss. I didn't want to disappoint myself. So during the 3 years I worked for Dr. Fletcher, I learned a lot of medicine. And then one day, he told me that I'd be more useful to him if I understood basic physics. Because I was running his pump oxygenator. It's like a heart-lung machine for extracorporeal perfusion in the operating room. And he asked me what I would do if there was pump failure. He suggested that perhaps I should take some additional science classes. And it was his idea that I should take science courses, starting with physics, in the evening classes and night school, and then work for him in the daytime. Well, I discovered that in order to take physics, I had to take its prerequisite, which is trigonometry. But the prerequisite to trigonometry was algebra 2, and I had only had algebra 1. So now you're beginning to know the story that evolves. It wasn't long after completing these series of courses that another similar chapter unfolded. Dr. Fletcher had a laboratory project inducing breast cancers into Sprague Dawley rats, and then tagging the implanted tumor with radioactivity, and then tracking the radio-labeled metastases. Well, in order to use radioactivity in the lab, all the lab personnel needed to become credentialed. And for me, this meant that I needed to take organic chemistry. Well, the prerequisite to organic was inorganic chemistry, and I also needed quantitative analysis on this side, both higher level courses than I had had in nursing school. So the story goes, I took my additional courses. I worked for Dr. Fletcher in the daytime. I took evening and night classes, and I did private duty nursing on the weekends, so to retain my nursing skills. And now we come to the next lesson from this mentoring experience that I would call the unexpected consequences. I can't call them unintended consequences because they may have been intended on Dr. Fletcher's part, but on my part, they were entirely unexpected. So after I've been doing this day, evening, night, weekend, weekday routine for a couple of years, one Sunday evening when we were both working late in the lab, Dr. Fletcher suggested that we go for a drink. There was a little restaurant not very far from the medical school. And it was on that occasion that he announced to me, you know, Sarah, I think you should think about going to medical school. The idea of medical school had never entered my mind. I was perfectly content with my wonderful life, my wonderful job. I was as happy as could be. And I replied, I can't go to medical school. And I offered 4 reasons why not. The first reason why I couldn't go to medical school in my mind was that I was too old. And he said, well, how old are you going to be in 10 years if you go to medical school? I think I was 23 at the time. I might have been 24. And I said, well, I'll be 34. And he said, well, how old will you be in 10 years if you don't go to medical school? The second reason I offered as to why I couldn't go to medical school was because I was a girl. In fact, It had never occurred to me to think about going to medical school or doing anything other than the expected career path for a young woman of the day, which was to become a teacher, a secretary, or a nurse. Well, Dr. Fletcher was a graduate of Dartmouth Medical School, and he told me that Dartmouth, which was a traditionally all-male school at the time, that Dartmouth had decided for the first time to open up its doors to women, to admit women into their medical school class. And furthermore, he thought that Dartmouth was actively recruiting women, which turned out to be true. The third reason I offered that I couldn't go to medical school is I didn't have enough money. And that also was true. And Dr. Fletcher told me about financial aid. In fact, in those days, it was not difficult to get scholarships or low-interest loans in order to get a higher education, a fact I had not known. And the fourth reason that I offered as to why I couldn't go to medical school was that I wasn't smart enough. And Dr. Fletcher got moderately annoyed with me, and he informed me that medical schools have panels of erudite professors and educators whose task it is to determine who has the wherewithal to master a pre-medical curriculum. And he asked me if I thought that I was better able to determine who could succeed in medical school than the admissions committee. Well, I said, no, of course not. So Dr. Fletcher had a counter argument for each of the four reasons that I offered why I couldn't go to medical school. And the subject dropped. Then, a couple weeks later, I learned that the grant funding for my hamster research project was coming to an end. And Dr. Fletcher told me that we had to write a progress report and reapply for a continuation grant if we wanted to continue this project. And the grant committee would be meeting in New York. And if I wanted to continue my research project, I needed to go to New York to defend the project. I'd never been outside of the state of Oregon. And my immediate response was, I can't do that. Shouldn't you do it? And he said, I'm operating that day. And if you can't defend your own research project, you shouldn't be working on it. I said I'd go. So the next step was really quite crafty on his part. He suggested that in conjunction with my trip to New York, I should visit his sister Sally, who lived in Woodstock, Vermont, and see the fall foliage. Immediately, my insecurities of making this grant presentation were masked by my excitement of going to New England in the fall. And then he added, and while you're visiting Sally, you might just cross the river and also visit Dartmouth. Upon arrival at Dartmouth, I found that my meeting was actually an interview for the medical school. And it was one of those picture-perfect, bright, sunny, crisp fall days with the autumn leaves in varying colors of transition, and I fell in love with the Dartmouth community. I left with a medical school application in hand, which I completed on my airplane trip home. And then 2 weeks later, on a Saturday morning, I got a letter from Dartmouth saying I had been admitted to their incoming medical school class. And once again, I consulted Dr. Fletcher. And I told him about my Dartmouth letter. He congratulated me. And then he said, well, how are you going to reply? And I said, well, they want a $50 deposit. And he said, the department will cover it, which I now believe meant that he opened up his wallet and paid my deposit. An important lesson to this real-life story is that effective mentoring is about finding opportunities for your students. It's about opening doors for them and guiding them along their way. And in my case, Dr. Fletcher not only opened the door, he pushed me through it and sent me flying down my professional pathway. And the mentoring story continues. Because toward the end of medical school, when I was thinking about residency programs, again, I credit Dr. Fletcher, because when I thought I wanted a career exactly like his, to become a cancer surgeon and a cancer researcher, he gently suggested to me that the world needed more surgically oriented radiation oncologists, and I should visit the group at Stanford. At that time, radiotherapy was an almost undiscovered field. There were fewer than a handful of training programs throughout the country. It was not competitive to get a residency position in radiotherapy. At Stanford, once again, I had the good fortune to be guided by wonderful role models and mentors. Most noteworthy, Drs. Henry Kaplan, Saul Rosenberg, and Mal Bagshaw. And they mentored by being effective role models and lifetime coaches, emphasizing scientific curiosity, investigation, excellence in patient care, and quality education at the very, very highest level. And I learned a lot from each of these giants, because when you have many influential mentors, you pick up many characteristics from each of them. From Dr. Kaplan, I learned about cancer investigation and cancer research. He was a tough taskmaster. He gave 100%. He expected 100% in return, and one dare not disappoint him. First paper I wrote with Henry Kaplan taught me the foundation of how to write a scientific paper. I worked very hard on this manuscript on pediatric Hodgkin's disease. And when, after many drafts, and I thought I had the perfect final draft, I gave it to Dr. Kaplan to review. And the next day, he returned it to me with his handwritten edits in red ink. The first page of my manuscript looked like a bloodbath. The entire page was red, with his critique written in miniature script all over the front page. Well, that paper went through 24 subsequent revisions before it passed the Kaplan test and was ready for submission. This painful process taught me how to be a critical thinker, a critical reader, and a critical writer. And now I'm not bad at being able to write for a scientific audience, thanks to Henry Kaplan. Dr. Rosenberg is known throughout the greater Stanford community as a doctor's doctor. He's one of the best, if not the best, clinician on the Stanford faculty. His patients adore him. His students respect him. Dr. Rosenberg taught me the importance of taking my own history, doing my own physical exam, and making my own independent assessment. That is an art which is oftentimes lost today in this era of the electronic medical record. Dr. Rosenberg believes in prospective clinical trials. He taught me how to write a protocol and how to conduct clinical research. The mentorship I had from Drs. Kaplan and Rosenberg enhanced my professional growth beyond measure and well beyond expectation. Now, the most engaging and the most approachable of my mentors was Dr. Mal Bagshaw. He set the culture for the Stanford Radiation Oncology Department. He was the most fun, and he's remembered for his joie de vivre. I gained immense personal growth and a lot of practical out-of-classroom knowledge from Mal. I learned a lot about athletics and a lot about Stanford football from him. So these lessons that I've learned could be briefly packaged as how I do it. But I have no specific tutorial to provide. I do believe in the team approach because one cannot have too many mentors. I'm passionate and I'm proud to be a mentor. My students and my trainees are like members of my family. Caring for them, mentoring them is caring for them, like caring for members of my family. Winston Churchill said it all. We make a living by what we get, but we make a life by what we give. And remember that our legacy is defined by the impact we have on those who follow us. It's a mentoring genealogy. We learn from our teachers of the past, we add some lessons of our own, and we pass this on to our students. And when looking back at my own career, there have been many people who have served as mentors to me. I've mentioned only a few. And now there are dozens and hundreds of students and trainees whose lives I've been able to make a difference. And many of them are now leaders in our field. They're department chairs and division heads, and each are exerting their own influence on their own trainees. The impact expands rapidly. There's nothing more gratifying to me than my relationship with my trainees and my colleagues. They will be the ones that will carry on this legacy of mentoring. Mentoring truly does put the joy back into medicine. Thank you for making this such a joyful experience for me.